Welcome to the MSUS HLS Industry Team Confessions of Health Geeks podcast. I'm Claire Bonacy with the industry team, and I have healthcare evangelist and avid road warrior John Bartow here to discuss the patient experience and fill us in on his next big adventures. So welcome, John. Thanks so much for taking the time to talk to me in between all your travels. I want to talk to you a little bit about the patient experience and how you've seen technology impact that over the last few years.
Yeah, so Claire, it's great. I'm actually not road warrioring today. I'm actually in the Tempe office where it's beautiful and sunny. So for all of you that live in climates that aren't pretty like this, sorry, but I'm enjoying it today. But what I've seen from a perspective of healthcare changing for the patient experience due to technology, there's a lot of great engaging experiences going on out there. And I'll share a couple of them that I've witnessed. One that I actually witnessed is I've given my lab system access to my location. So when I have a lab order in from my doctor that says I need a blood draw, they know where I'm at. And so I had an actual interesting example where I was driving around, I was stopped at a restaurant for something, and the lab system popped up a message on my phone and said, hey, you're within walking distance of our lab, and we've got a phlebotomist ready, so this blood draw that you need to have done can be done in 5 minutes. Come on in. And I'm historically bad at getting that kind of follow-up procedure since I travel so much. So they actually prompted me to be conformant, frankly, to my care and made it very, very convenient for me. So there's a great example of the changing of patient experience based on technology. Some other things, one of our clients has actually gotten to the point that they navigate for their patients when they get within 4 miles of the hospital. They know where the patient is. They actually suggest exactly where they should park. They give them wayfinding capabilities to navigate their way to their sessions. They basically monitor everything that's going on from a surrounding perspective environmentally, and they're really taking care of the patient in a holistic experience far beyond the walls of the health system. So we're seeing tons of that kind of stuff. And then actually keeping people at home and at a distance and doing a lot of things over a telehealth platform is huge going on right now around patient experience. So we're seeing lots of great things happen.
Yeah, those are great examples. Yeah, actually, I do use telehealth as kind of my main provider now. But definitely, I think anything that can make more convenience for the patient is kind of where we should be going. So those are great examples.
You millennials, you're all using the telehealth stuff.
Exactly. It works so much better. I don't want to drive. I'd rather just call in. So
yeah. It works I use Teladoc when I'm on the road occasionally. If I have something I need and I don't have to go see anybody, I can stay in my hotel room, not infect anybody else.
Exactly. Stay in your pajamas and get help. That's the best way to do it.
Yeah.
Great. So you've always been very connected with the health systems and the hospitals that you're working with. So how are you seeing that technology is extending really beyond the EHRs in these hospitals?
Yeah, so the patient experience piece was a great example. So those types of things, an EHR helps enable that, but you need a communication system to actually communicate with them. We're seeing things like bots integrating into the environment to basically be able to do that communication. We're also seeing relationship management type tools be able to help us understand where the patient is, when they're at a certain place, what they might need, engage their family. We're seeing lots of great capabilities come around in that space. And what's very interesting to me is that consumerism is really starting to drive the healthcare requirement. You even mentioned that you use telehealth as your primary platform. So think about this. If you're a health system and you're building large facilities with lots of doctors for people to mobilize themselves and come to you, and telehealth or those types of things take over and the experience is better, you might be sitting with a huge amount of capital assets that are going to go unoccupied. So you got to be thinking about how do you engage that patient where they're at when they need care and make it convenient for them. Otherwise, you might be building the shopping mall that was coming up in the 1980, 1999, 2000 era, which is less than occupied now.
Yeah, exactly. Yeah, things are definitely changing, and it really is going more towards that convenience model. So I agree with everything you've just said.
Yeah.
So since you are always on the road, you're always traveling, can you share what your next speaking engagement is and what you're going to be talking about at that?
Yeah, I seem to have plugged into a speaking circuit around how do you build the hospital of the future. And so I've actually even been asked to go on retainer with a couple of these architectural firms to basically help them design what kind of technology would go into the future hospital. So one of the events I got coming up is at the end of February. I'll be in Houston, Texas, speaking to a organization named the American Institute of Architects, and they have a subdivision in that group that does nothing but designs and builds hospitals and health systems. And so I'm there to kind of give the keynote on, what kind of technology should you be planning for in those. And I got another follow-up event to that, similar to it, in Miami coming up in May. So I'm starting to see, this will be like the 6th of those that I've done. So I'm starting to see a lot of interest in that space. And then we obviously have HIMSS coming up, right? So there'll be a few speaking engagements at HIMSS. I won't disclose what they are yet. I'm still negotiating a couple of them as far as what I'm going to actually show up to and do. But HIMSS this year is kind of interesting for me. I've been there 27 years. I missed 1 year, so they weren't all together. And I'm very happy that HIMSS has finally decided that you need to be near your family on Valentine's Day, so they no longer do it over the Valentine's Day.
Oh, I didn't know they did that. Wow.
It used to be always on Valentine's Day. And my wife used to laugh. She used to say, "Who are you going to visit for Valentine's Day this year?" Right? It was always HIMSS, and she goes, "Why not hers? You're going to HIMSS." But basically, the thing that's interesting this year is my children actually have coinciding spring breaks this year, so they're drawing me away from HIMSS after a couple of days, and we're going to end up in the Bahamas and go on a diving trip. And I haven't been diving in years, so that ought to be interesting for me. We'll see if I survive.
That's interesting. Yeah, well, I'm excited to see you at HIMSS, and the rest of the industry team will be there as well. So it'll definitely be an interesting and really fun week for sure.
Yeah, I'm looking forward to HIMSS. We got a lot of great things going on this year, and it's a really exciting year for me as far as HIMSS is concerned, because I think there's so many announcements that are going to come out.
Yeah, I definitely agree with that. Great. Well, thanks so much, John. I'm really glad we could talk a bit today, and I'm looking forward to hearing you more in the future. Thank you all for watching. The industry team will be doing more podcasts and blogs in the future, so check back for future content, and feel free to leave us any questions and comments below. Thanks so much.